my patient's room. I'm providing patient privacy and then I'm performing hand hygiene. Can I go ahead and get your first and last name?
Dylan Potts.
And can I go ahead and get your date of birth?
11/18/94.
Perfect. Dylan, we're going to go ahead and do a head and neck assessment onto you today since you're being discharged home. Are you having any signs of pain?
No.
Do you have any complaints that you want to tell me about?
Nothing.
Okay. So when I first walk into my room, when I'm assessing with my patient's hair, skin, and nails, so I'm looking at my patient's skin. His skin is warm, dry, it's intact. I don't see any lesions on this arm, and then I'm looking at this arm, warm, dry, and intact throughout. I'm looking for any lesions. There's no lesions on this arm as well. I'm also looking at the skin on my patient's neck. It's warm, it's dry. I'm also looking at the skin on my patient's face. It's warm, dry, and it doesn't have any overproduction of any oils like that. I'm also looking at my patient's hair. His hair is well groomed. It's evenly dispersed throughout. It's very thick. There's no dandruff or lice, any signs of lice or anything like that. I'm also looking at my patient's fingernails. His fingernails are well groomed. His capillary refill is 2 seconds, so that means he has good perfusion to his fingers. I'm also checking his skin turgor. His skin turgor is brisk, which means that he is well hydrated, and he has good perfusion to his arms as well. And I'm also looking for clubbing of my patient's fingers. There is no clubbing of my patient's fingers, and this is a normal finding. So now I'm gonna go ahead and look at the head, face, and neck. Looking at his head, it is normocephalic. And then I'm gonna go ahead and palpate your sinuses. When I palpate your sinuses, let me know if anything hurts, okay?
Okay. Nope, no pain. Nope.
No pain? Perfect. Okay. So I'm gonna take a cotton ball test. The cotton ball test is testing for cranial nerve number 5, and this is for the sensory test. What am I touching?
My forehead.
What am I touching here?
My left cheek.
And what am I touching here?
Right cheek.
Here.
My nose.
And then here.
My chin.
Sorry.
Excuse me.
Cranial nerve number 5 sensory is intact. I'm also going to go ahead and have my patient puff his cheeks and then smile and then raise your eyebrows. Okay, so this is saying that cranial nerve number 7 is intact. And then go ahead and clench your teeth and then relax. Clench your teeth again and then relax. So this is saying that cranial nerve number 5 motor is intact. I'm also going to check your thyroid. If you could just go this way for me. Go ahead and put your head down. Perfect. So when I'm doing this thyroid, I don't feel a thyroid, which is a normal finding. And when I'm also feeling the trachea is midline, and the thyroid, since I don't feel it, it would be midline too. And this is stating that cranial nerve number 11 is intact. I'm also going to go ahead and auscultate my patient's carotid artery. So I'm listening to my patient's carotid artery. There is no swishing sounds and there's no whooshing sounds, and then I do not hear any sounds of bruit, which is a normal finding here as well. And then the last thing that I'm gonna do to check for his head and neck is I'm gonna push down on his shoulders and have him push up. Perfect. I'm gonna go ahead and put my hand on his cheek, and can you turn it towards my cheek? Perfect. And then this side. Perfect. Okay, so when I'm doing this test, I am testing cranial nerve number 11. The next thing I'm gonna go ahead is I'm gonna go ahead and check my patient's ears. I'm gonna do a cranial nerve number 8 test. By doing this, I'm gonna have you take a finger and close one of your ears up. I'm gonna whisper a word to you and have you whisper it back to me.
Hello.
And what was the word?
Hello.
Hello was the word. This means that cranial nerve number 8 is intact. I'm also gonna have you stand up for me. So when my patient is standing up and doing this test, he would be standing for 20 seconds. His eyes are closed. He is not swaying side to side. This is showing that cranial nerve number 8, the vestibular portion, is intact. Go ahead and sit down for me. I'm also going to be checking my patient's ears. When I'm looking at the outside of my patient's ears, it's clear. The peanut does not have any built up of dirt or any kind of discharge in it. When I'm touching his tragus, do you feel any pain?
Nope.
When I'm touching your peanut, do you feel any pain?
Nope.
Awesome. When I'm doing an ear check, I'm pulling the peanut up and back. And as I'm looking in the ear, I'm looking at the tympanic membrane. The tympanic membrane is gray. It doesn't have any kind of rupture to it, and there's no excess liquid or discharge coming from it, which is a normal finding. So that completes my ear test. I'm also going to move on to my eyes. I'm going to check my patient's eyes. So I'm going to have him take this and hold it over one eye. I'm going to have him look at this picture and then remove that from your eye. When you remove it from his eye, his eye doesn't move off to the side, it stays straight. And his other eye stays straight as well. There is no drifting in either eye. How many fingers am I holding up?
2.
2 fingers. Cranial nerve number 2 is intact. I'm also going to do a test where I have you follow my fingers. Okay, so he was able to follow my fingers without any difficulty. His eyes didn't bounce back. There was no twitching or anything like that. And this means that cranial nerve 3, 4, and 6 is intact. I'm also going to be checking my patient's pupils to light. Go ahead and look straight at me and don't follow the light. When I do this test, I'm checking the perla of the eyes. Perla stands for pupils equally round and reactive to light. Both of his pupils were equally round and they were reactive to light. And this also tests for cranial nerve number 3. The next thing I'm going to look at is I'm going to look at my patient's nose. And can you go ahead and look up for me? Awesome. When I'm looking at my patient's nose, the tubinas, the middle and inferior tubinas, oh my goodness, tubincas are pink and they're intact. This one's a little bit more discharge. The other one's dry, and more dryness is a normal finding versus having the discharge. When I hand you this, can you smell it for me? What smell is that?
Vanilla.
Vanilla, perfect. This means that cranial nerve number 1 is intact. The next thing I'm gonna do is I'm gonna go ahead and check my patient's throat, mouth and throat. So when I'm looking into my patient's throat, can you go ahead and open for me? I'm first looking to see if there's any lesions in his throat. I do not see any lesions. Go ahead and lift your tongue up. There's no lesions underneath the tongue. The skin is intact. It's pink. I don't see any signs of cyanosis in the mouth. The roof of the mouth does not have any signs of cyanosis either. It's also pink and intact. Everything is moist. He does not have an over dry mouth. I'm going to use a tongue depressor and depress the tongue. And I'm looking in the back of the mouth and I see the uvula. The uvula is symmetrical and it's in midline to the mouth, which is a normal finding. I'm also going to go ahead and check my patient's cranial nerve number 12. So to check my patient's cranial nerve number 12, I'm going to have you stick your tongue out and move it side to side. My patient is able to do this, so this means that cranial nerve number 12 is intact. And then I'm also going to have you stick your tongue out and then go keep doing it. Perfect. So when he says this means that the soft palate movement is going up and down, so the uvula is open up and down to the sound. This means the cranial nerve number 9 and 10 is intact. And then when I also was looking in his mouth, I was checking his tonsils. His tonsils were not enlarged. They didn't have any redness to them or swelling. There was no green pus or any kind of mucus on them, so they were healthy, and his tonsil grade is +1. And this completes my assessment for my head and neck.